Hi, the purpose of this video is to provide a demonstration of interprofessional team communication between the speech-language pathologist and the nurse in working with the patient with dysphagia. The video will include a demonstration of a swallow evaluation by the speech-language pathologist and collaborative team planning for managing the diet and medications for the patient with dysphagia. At the conclusion of this video, the learner will be able to demonstrate different roles that speech-language pathology and nursing have on the interprofessional healthcare team, implement the process of interprofessional communication for speech-language pathology referral, swallow evaluation, and follow-up on diet recommendations, perform patient swallow evaluation and monitoring the patient response during the process, differentiate between different types of diets and the process of administering medications with varied food consistencies. Create a collaborative plan of care for food and fluid intake and medication administration for a patient with dysphagia. Hi, Darla.
Hi, Deb. How are you?
I'm good. I'm so glad to see you. Did you get the order I put in on Mrs. Schmidt?
I did get the order.
Okay.
And I was just reviewing her medical chart right now. Kind of take a look at it. And it looks like she had a stroke a couple of years ago, and she had expressive aphasia, a little dysphagia, a little swallowing issues at that time. But she went through rehab, and she recovered nicely. So she was discharged on a regular diet at that time and had some use back of her right arm again.
Yeah, she did. And in fact, she's done really well. She had her hip surgery yesterday. I screened her this morning because of the history of the stroke and also just because she was intubated post-surgery.
Okay.
And she did have some coughing with the water, so I want to be really careful because I understood that they can kind of regress after, especially anesthesia and especially a surgery with intubation.
Exactly.
So I really appreciate you coming in right away. I have several home meds I need to get her on.
Okay.
So I'm hoping we can figure out some kind of situation for her.
Great. That's a really good call because many patients who have neurological involvement will have difficulty with their swallowing. So thank you for catching that. Wonderful.
Okay. Well, I'm glad you're here. That's good. Do you have time now?
I do have time, and I've just finished my chart review looking at her, so I'm ready to go do this.
Okay, that's good. I would love to introduce you. I'd also just I'll catch up on some charting in there just so I can kind of watch and see how she does.
Okay.
When I did her noon vitals, she did have a little drop in her oxygen saturation.
Okay.
So that's why I'm a little concerned about, I'm hoping I didn't push her too hard this morning.
Okay.
I tried to stop her right away, but I want to make sure I kind of know what's going on with her.
Okay, thanks for letting me know that.
Okay,
I appreciate
good.
that.
All right,
Okay.
well, let's go. I'll introduce you.
Very good. Thank you.
Key points for the speech-language pathologist in performing a swallow evaluation. Gather needed food and fluid supplies prior to entering the patient's room. Have the patient upright, preferably sitting, and as close to a 90-degree angle or as high as safely tolerated. Assess that the patient is awake, alert, and ready to cooperate with the evaluation. Assess that the mouth is clear and dentures in place if appropriate. Sit or raise head of bed to eye level of the patient to avoid hyperextension of the neck and to provide assistance if needed for feeding. Eye level also provides a good view of the throat and the swallowing process. Complete an oral peripheral examination. Present the different food consistencies and food textures using a specific order from thin to regular textures if appropriate.
Good morning.
Hey, there she is. Okay, Darla.
Hi,
Good.
how are you, Mrs. Schmidt?
I'm fine, thank you.
Nice to meet you, Darla Hagee, speech therapist. I'm here to do your bedside swallow evaluation. So I understand you had a little bit of difficulty when you swallowed some water with your nurse earlier.
I did.
A little bit, okay. So that's what I want to see. I want to see, make sure that you can swallow safely foods and liquids because it's important that we protect your airway right now. Especially after a new stroke. Okay, so this will be painless. I have no shots. That's always the good news. And I do have a few bites of food and liquid, so that's always kind of fun too. So the first thing that I want to do is I'm just looking at the symmetry of your face, and I'm going to look at inside your mouth a little bit and at your tongue and your lips, and then from there we'll move on to some water and some food. So the first thing, if you could just smile for me. Okay, beautiful, and then open your mouth. Excellent. And then stick out your tongue as far as you can at me. Beautiful. And then lift your tongue all the way to your nose, as high as you can. Good. And then down to your chin. Excellent. And then we're going to go side to side a little bit with your tongue. Back and forth. Beautiful. Okay, so I have a little flashlight. I'm going to look inside your mouth. Let me see. Say ah. And stick out your tongue and say ah. Ah. And how about ah, ah, ah?
Ah, ah, ah.
Beautiful. Thank you very much. And then one other thing I'd like to do is I'm just going to touch your throat lightly, and I want to feel your swallow. So just follow whatever saliva you have in your mouth. Perfect. Excellent. Okay, so we are ready then to move on to liquids first. And I'm going to give you a little bit of water by spoon, okay? So I'm going to give you a little bit of this. Excellent. All right, and so this time, let's see, what hand is stronger for you? That one? I'll help you a little bit with the cup to just stabilize it. I want you to just take a single sip, just like you would if I wasn't here. Okay. Perfect. Oh, okay. Okay, a little bit of difficulty there. All right, okay, thank you. Let's try something else then. Can you say ah for me?
Ah.
Okay, good. So that voice is nice and clear. The next one I want to do is this is Nectar Thick, and it's been sitting here for a couple minutes, so it's thickened up just a little bit. Let me fix that. This is Nectar Thick water, and we just use a thickener. It's mostly cornstarch. Okay, so I'm going to give this to you by spoon first, and this moves through the throat a little slower, and so many times we can tolerate this better than thin liquids. So go ahead and take a sip. Oh, easier, yes? And so let's try this by cup again. Go ahead. Good. Beautiful. All right. That's 3 consecutive sips. Say ah for me.
Ah.
Nice, wonderful. Okay, and I'm going to have you hold that cup, take another sip, and I'm not going to help at all this time. So go ahead. Take 1 or 2 sips. Beautiful. And say ah for me again.
Ah.
Nice, clear voice. Okay. So then now we're going to move on to foods a little bit, all right? And hopefully you're not tired of applesauce yet.
I love applesauce.
Oh, wonderful. So I'm going to give you a teaspoon of applesauce here. And so go ahead and take that for me. No problem?
No problem.
Okay, I'm going to have you just open your mouth for me. Okay, it's all clear, no residue, no little bit of applesauce left. Everything is clear. Looks good. Let's try another one. Okay. Say ah.
Ah.
Okay. And then why don't you take a bite like you would if I wasn't here. Okay. I'll just hold the bottom of that. I'm glad you like applesauce. That's helpful. Good. You like that. Wonderful. I'm just going to look inside your mouth one more time. All right. Excellent. Okay. So now we're going to move on to something different. These are chopped pears. And I'm just going to give you one of these and see how you do. Okay. Right there. Okay. Okay. Let's take a little look and see if there's any residue as well. All right. All right, I know you had a little bit of difficulty with that particular bite. I just want to try one more. So, I can pick that up later. Okay. Here you go. Okay. Okay. You all right? Okay. Okay. I'm just going to look one more time in your mouth and make sure we got everything. All right. Okay. So based upon how you did right now, and this is for this particular slice in time, not necessarily forever, okay? But just for right now, I'm going to put you on a diet of pureed foods. So like applesauce, pudding, foods that have been pureed. And the reason for that is that they're easy to chew. They stay in a nice little ball in your mouth, and then they swallow easily, and they don't disband and go everywhere and cause any food particles to go into your lungs. And then I also want to put you on liquids that are thickened to the consistency of nectar. And no straws for right now. And that's just to protect your airway. We don't want you developing aspiration pneumonia. Yeah, pneumonia's not good. But I will be back tomorrow and see how you're tolerating that diet, and if you're able to have your diet advanced at that time. Okay. So Deb, probably her meds, if you could crush them.
Sure. Okay.
Instead of giving them whole, I want Deb to crush your medications, and she's going to put them in a carrier like applesauce or pudding, and then you can swallow them that way. That's the safest way right now for you to take your medicines.
Okay. And we won't put them in a whole cup of applesauce. I'll just take a little bit. We'll put the pill in that, so make sure you get your full med. So if your appetite's slowly kind of coming back, then we'll just give you a little bit of applesauce, and you can still eat as much of it as you want, but you don't have to eat the whole container. So you never want to mix your meds in the entire container. Does that make sense?
Yes,
so we'll do it
I
that way. But
understand.
you can eat as much as you feel comfortable eating. The doctor said you can advance your diet if we can approved.
Yeah. Oh, that's a great call. Much better to have all of those meds in a small amount of applesauce than the whole container. Yeah. Thank you.
Yeah, and as we work at this, you might even have to go to rehab again with some of these things. You might need to have speech therapy at home. So those are just kind of thinking about your discharge planning. But again, if you have to have meds at home that are crushed, they'll send you with a crusher. But again, remember to put those in a small amounts so you get all your medications in. Does that make sense?
Yes, I
Okay, good.
understand.
Good.
So if you have any concerns, or if Deb sees anything that concerns her about your swallow, she'll be contacting me, and I'll be right up to check on you. Okay.
Thank
And then-
you.
You're
Yeah.
welcome, of course.
Thank you so much for coming in.
Yeah,
And
thank
And I
you.
also heard you mention the no straws.
Mm-hmm.
So do you want to explain to her, like I understood, maybe you want to explain to her just why the no
Sure.
straws so you understand that.
Well, in the hospitals, we always give straws to most all the patients, right? But if you're having difficulty swallowing, it tends to throw the liquid back far too quickly into the mouth, and it's much more easy to choke on the liquid that way. So just for right now, we're not going to have you use any straws. We just want you to take all your liquids that are thickened to nectar consistency by cup.
Okay.
Okay? So thank you for that, and I will see you tomorrow. Okay.
Great.
Thank
So,
you.
oh, yes, thank you so much. And Mr. Schmidt, nice job. All right. Quick follow-up question.
Sure.
In terms of the computer in the diet order.
Mm-hmm.
So under modifiers, I'm putting Paride under the diet.
Mhm.
Okay. And then I'm putting honey thick. or
Nectar-
thick.
nectar
Nectar
thick.
thick. So there's a
Mhm.
category for that. I just checked on the computer. I saw
Right.
that. Okay. And I will call Dr. Anderson right now and get those orders into the diet. So you could, by dinner time, you can already get a diet tray. You know,
Yay.
that'll be
Yeah.
set for you, okay? And
Perfect.
looks like you like the applesauce. So if you're hungry, we'll go ahead and give you a little more applesauce, and we'll try with a little bit of pudding kind of stuff. Want to start your diet back slow to kind of see how you're doing, and then because I don't want you to get nauseated and stuff. You just had your surgery yesterday, so does that make sense?
It does.
Okay,
Thank you.
good,
Wonderful.
good.
Thank you very much.
Yeah.
Appreciate it. And I'll see you tomorrow then.
Darla, thank you
thank you.
very
Thank
much
you.
for being up here right away, and I'm going to get your pills ready, okay? All right.
All right. Thank you. Bye-bye.
Speech Language Pathology Swallow Evaluation. Conduct a verbal interprofessional team discussion about the results and the recommendations to create a collaborative plan for nutrition, fluids, and medications. Include the patient and caregiver if possible. Speech language pathology, documentation, recommendation should be recorded in the medical record. Nursing should contact the provider to discuss speech language pathology recommendations, obtain the diet order, and address any medication issues. Speech language pathology should post the recommendations for liquids, diet, and feeding at the patient's bedside. Both speech language pathology and nursing should document the patient's tolerance to the evaluation, recommendation, and revised PO intake plan in the medical record.